Hello everyone! Welcome back to MJ Pharma. Today, we are covering the drug of choice in pregnancy. When it comes to treating infections, hypertension, or even pain during pregnancy, safety is everything. Let's get started! Drug of choice for ectopic pregnancy. Methotrexate. Drug of choice for induction of labor. Oxytocin. Drug of choice for postpartum hemorrhage in pregnancy. Oxytocin. Drug of choice for hypertension in pregnancy. Alpha-methyl-dopa. Drug of choice for endometriosis in pregnancy. Danazol. Drug of choice for asthma in pregnancy. Beta-2 agonists. Drug of choice for postpartum breast engorgement in pregnancy. Oxytocin. Drug of choice for seizures and eclampsia in pregnancy. Magnesium sulfate. Drug of choice in seizures during pregnancy. Phenobarbital. Drug of choice for the hypertensive emergency in pregnancy. Labetalol. Drug of choice for postpartum hemorrhage in pregnancy. Oxytocin. Drug of choice for falciparum in pregnancy. Quinine. Drug of choice for cerebral malaria in pregnancy. Quinine. Drug of choice for gonorrhea in pregnancy. Penicillin or ceftriaxone. Drug of choice for toxoplasmosis in pregnancy. Spiramycin. Drug of choice for malaria in pregnancy. Chloroquine. Drug of choice for acne. Erythromycin, oral, or benzobenzoate, topical. Drug of choice for epilepsy in pregnancy. Phenobarbital. Drug of choice for mania in pregnancy. Olanzapine. Drug of choice for hyperthyroidism in pregnancy. Propylthiouracil. Drug of choice for hypothyroidism in pregnancy. Levothyroxine. Drug of choice for bacterial vaginosis in first trimester. Clindamycin. Drug of choice cholera in pregnancy. Furazolidone. Drug of choice for typhoid fever in pregnancy. Ceftriaxone or ampicillin. Drug of choice for amoebiasis in pregnancy. Metronidazole, contraindicated in first trimester. Drug of choice for amoebiasis in first trimester. Furazolidone. Drug of choice deep vein thrombosis. Heparin. Drug of choice for preventing neural tube defect in pregnancy. Folic acid. Drug of choice for anticoagulation in pregnancy. Heparin. Drug of choice for mania during pregnancy. Lithium. Drug of choice for myasthenia gravis in pregnancy. Neostigmine. Drug of choice for thrombophlebitis in pregnancy. Aspirin. Drug of choice for urinary tract infection during pregnancy. Ampicillin. Drug of choice for HIV in pregnancy. Zidovudine and nevirapine. Drug of choice for resistant typhoid in pregnancy. Ceftriaxone. Drug of choice for tuberculosis in pregnancy. Isoniazid with rifampicin. Drug of choice for vitamin B12 deficiency in pregnancy. Cinacobalamin. Drug of choice for iron deficiency in pregnancy. Ferrous sulfate. Drug of choice for antiplatelet action in pregnancy. Aspirin. Drug of choice for anxiety in pregnancy. Benzodiazepines. Drug of choice for pain in pregnancy. Aspirin or paracetamol. Drug of choice for depression in pregnancy. Tricyclic antidepressant. Drug of choice for superficial thrombophlebitis in pregnancy. Aspirin. Drug of choice for bacterial vaginosis in first trimester in pregnancy. Clindamycin. Drug of choice for rosacea in pregnancy. NSAIDs. Drug of choice for seizures in pregnancy. Benzodiazepines. Drug of choice for seizure maintenance in pregnancy. Phenobarbital. Drug of choice for rheumatoid arthritis in pregnancy. Aspirin. Drug of choice for schizophrenia in pregnancy. Phenothiazines like haloperidol. Drug of choice for seborrheic dermatitis in pregnancy. Salicylic acid. Drug of choice for psoriasis in pregnancy. Topical corticosteroids or salicylic acid. Drug of choice for Shigella dysentery in pregnancy. Ampicillin. This video is for educational awareness only. Always follow guidelines and consult specialists when prescribing during pregnancy. Thanks for watching. If this helped, like, subscribe, and hit that bell icon to stay updated with MJ Pharma.